The medicalization of hyperactivity in children. Attention deficit hyperactivity disorder, or ADHD, is defined as a childhood-onset neurodevelopmental disorder that is characterized most commonly by developmentally inappropriate hyperactivity. Global prevalence rates are about 5% but are likely underrecognized in certain groups such as girls and older children. Children with ADHD show increased difficulties in school and often exhibit academic underperformance. They may also be prone to behavioral problems, and ADHD has been shown to have a negative impact on a child's emotional well-being. ADHD first started being medicalized in countries such as the United States in the 1960s, and is now one of the most commonly diagnosed psychiatric conditions in children in the United States. Diagnosis really started to increase dramatically around the world in the 1990s. So what is the reason behind this rapid increase in medicalization and diagnosing of ADHD? Peter Conrad, an American medical sociologist, argues that expanding medicalization in Western societies has been the result of changes in pharmacology's role in medicine. Conrad's view is consistent with the philosophical work of Michel Foucault, who critiques modern medicine as being dehumanizing and often politically motivated. Since the passage of the FDA's Modernization Act in 1997, drug companies have started to advertise aggressively to the public, whereas before they mostly marketed to doctors. This has led to the popularity of drugs such as Viagra and for ADHD, Ritalin. Ritalin, or methylphenidate, is the most common drug treatment for ADHD and has been shown to reduce symptoms such as hyperactivity and impulsivity. However, a review noted that the drug is associated with a higher risk of sleeping problems and decreased appetite in children. Of most concern, however, is the long-term effects of Ritalin use, which may include a reduction in body weight and growth restrictions in children, but much of this is yet unknown. Another issue is a study in Week 1 lecture that found that in Vancouver and Montreal, in 66% of drug sale visits to doctors, no potential harms were mentioned, which leaves doctors and patients uninformed. Due to these issues, recommendations worldwide advocate for Ritalin use only in severe cases, and behavioral non-pharmacological intervention should be explored first. However, in the United States, recommendations do not advise against the use of drug treatment for preschool children or children with mild ADHD. The vested interest of drug companies in the medicalization of ADHD, combined with potentially negative side effects of Ritalin and lenient guidelines in the US, means that we must remain well informed and stay critical in our view of medicating children.